Hi, my name is Josh Ryder. Welcome to Sports Injury Podcast Episode 1. This one is geared a little bit more towards the sports medicine professionals, sports physical therapists, athletic trainers. I wanted to take a little bit of time to discuss infrapatellar pain. And I think infrapatellar pain, my thought is that we really need to classify this a little bit differently than your classic patellofemoral pain syndrome. The infrapatellar pain is below the kneecap. So what we want to do is think about anatomy here first. What are the structures in the infrapatellar region? We have the patellar tendon up the middle, and then the medial and lateral sides of the infrapatellar fat pad. On the medial side of the patellar tendon and on the lateral side of the patellar tendon. So the first thing we want to do as far as assessment is get a good palpatory exam. Often the patients will not be able to distinguish exactly where the pain is. They'll kind of point in the vicinity of the infrapatellar region. So with a good palpatory exam, it'll really reveal what are our problem structures here. So poke on the patellar tendon up the middle, poke on each side of the fat pad, and see what's going on. So let's talk a little bit now about treatment of infrapatellar pain. So I'll tell you kind of what my go-tos are for my patients, what works with them. As far as if it's a patellar tendonitis, my go-tos would be instrument-assisted soft tissue mobilization to the patellar tendon, provided that there's no contraindications there. Other than that, we got to address the quad. Stretch the quad and foam roll the quad would be key. I'd also like to add that you may be working with a youth athlete that has some kind of apophysitis, which relates to an irritation of the growth plate. So you may see either on the distal side, you might see an Osgood Schlatter's. On the proximal side, you might see a Sinding-Larsen-Johansson syndrome, which is a super long-winded name. But yeah, both of those diagnoses would be treated the same as you would treat the patellar tendonitis. As far as infrapatellar fat pad pain, so my go-to there, where I've had a lot of success, is doing a Kinesio taping for the infrapatellar fat pad. What I do is a space correction taping, which is a decompressive taping. So it's a light tension from the center out. And what that does is decompresses the fat pad. Keep in mind that with the infrapatellar fat pad, from what we know, it doesn't like pressure. Often the cause of infrapatellar fat pad pain is a direct trauma to the fat pad. And because of that, you're not going to look to massage the infrapatellar fat pad. So I really like this idea of the decompressive taping for it. And like I said, I've had good results clinically doing it the last few years.